So how does one find a good HDR doctor?
Well, it's a little bit challenging. I'm very proud of the program that we developed at UCLA. I dedicated myself to brachytherapy, my practice to brachytherapy, and since 1991, high-dose rate brachytherapy. And it's quite a program to set up. As I mentioned earlier, it requires specialty nurses, specialty physicists, therapists, dosimetrists, the operating room team, the doctors. It's a village. It's not just one person going in and doing this treatment. And at UCLA, we have a staff of 3 full-time brachytherapy physicians in addition to myself. I'm now part-time. We have physician's assistants, nursing assistants, and just really a great team and a great facility with a CT scanner, a dedicated CT scanner, one of the few types of CT scanners that fits over the patients with a large bore. We are getting an MRI scanner right there in the department, as well as the operating suite to make it very comfortable. So we have a level of expertise. We're doing a large volume of cases and is well known in order to do a good job. You really need to be doing a lot of cases. So we have experience not only in prostate cancer, which is our number one disease that we treat, but in head and neck and GYN and some of the other sites that I mentioned earlier. This is a very, very busy program. It does require training and experience, and since there are so few programs in the United States, it's hard to get the training. So I'm pleased to say that the current chairman or director of the program was trained by a colleague I trained at UC San Francisco. So that's Albert Chang. We trained Dr. Pooja Venkat, who's just a fantastic young doctor and enthusiastic in brachytherapy, and Dr. Alan Lee. Those are our 3 young, at least by my standards, younger doctors who are doing a great job at UCLA and promoting and developing, working with interventional radiologists, treating special sites in the body that were previously not treated with brachytherapy before, like liver and deep-seated tissues and so forth, as well as doing a fantastic job on the prostate cancer program, one of the best in the country.
Wow. So I know you've trained a lot of people in your department, but can you speak to all the other places you've trained? You've trained a lot of people.
Well, I have. I've felt that training and education and trying to get as many people familiar with brachytherapy as possible, because it's such an effective treatment modality. And since you have to have both surgical and radiation training, that makes it a challenge. And with HDR, the rest of the equipment and personnel that go with it also have to have that training. But I've trained residents from Stanford, from UCLA, the director at UC San Francisco I trained, various doctors throughout the country, people from international sites, various countries from Italy or Egypt or wherever, England, wherever, come over and spend various amounts of time. So I've welcomed training anybody from a physician in practice down through medical students who are wide-eyed and very curious about what we're doing.
Outside of UCLA, do you have any other trusted sites outside of the country if people are maybe on the East Coast and looking for HDR?
Yeah, there are certain places that have more levels of expertise. I'd be happy to provide you a list. I'd rather not sort of try and name a long list here, but sure, there are sites that are good colleagues and have good track records and are dedicated physicians, and those are the kinds of people I'd be happy to refer you to.
Awesome. So if you would like more information about anything we talked about, you can go ahead and contact our helpline team and they will be available to talk to you. The number is at our website, PCRI.org, and you can look up other information on prostate cancer treatments. And if you like this video, go ahead and give us a thumbs up. The reason those thumbs up matter is because that lets Google know that this video is helpful to you and it can help other patients, and we get on a suggested video list. Subscribe to our YouTube channel if you would like more information in general about prostate cancer. We cover every topic we could possibly think of, and we hope you have a great week.